This is a download from BFM 89.9, the business station.
Good afternoon and welcome to the show. I am Mira Sivasodi. With me today, Dato Dr. Azmee Muhammad Ghazi, consultant cardiologist, clinical director of the Heart Failure and Heart Transplant section in Institute Jantung Negara. Today's topic is more about heart failures. I think a lot of us use the word heart attacks, heart failure very loosely. There is a big difference between the two, and that's exactly what Dr. Azmee is going to be talking to us about. Welcome to the show. How are you today?
I'm fine, thank you. Thank you very much for having me today.
You're most welcome. You know, Dr. Azmee, what is a heart failure? I mean, can you just explain to me what's actually going on in the heart when that happens?
Okay. Heart failure is defined as the inability of the heart to act as a pump. So there are various causes of heart failure, and when someone develops heart failure, then there is a reduction in terms of the blood supply to the brain, to the kidney, to the rest of the tissues around in our body, and it causes a lot of symptoms. So it is important for us to know to recognize the signs and symptoms of heart failure, and to know what are the important causes that can cause heart failure as well.
So what's the difference compared to a heart attack?
Okay, heart attack is actually problems with the coronary artery disease. So if there's an occlusion of the coronary artery disease, blockage, yes, and causing a lack of blood to the heart muscle, that is what we call a heart attack. Heart attack, if it's not treated early, it can develop into what we call heart failure. So the idea of treating heart attack earliest possible is to prevent the damage of the heart muscles, which actually lead to heart failure.
Heart failure. So a heart attack can actually cause a heart failure.
Yes.
What else can actually cause a heart failure?
There are some conditions, for example, where you are born with congenital heart disease or cardiomyopathy. So these are some of the causes of heart failure. Other causes which includes poorly controlled hypertension. So that's the reason why we treat hypertension, is because we want to prevent the development of heart failure towards the end. There are other rare causes, for example, arrhythmias. Some people have an irregular heartbeat that can cause heart failure, and also other causes, for example, thyroid disease or any problems with infection in the heart muscle that can also lead to heart failure. There are various causes.
Sure. And there are different types of heart failure?
Yes, yeah. In terms of different types of heart failure, you can divide it into either acute heart failure, which usually due to a heart attack. So that's an acute, it's sudden onset. And there is also a chronic heart failure, where someone who had a acute heart attack developed acute heart failure and survived and discharged from hospital, but then they actually end up with what we call a chronic heart failure. So they're quite stable, even though that the heart is not functioning very well, but they manage to live normally, comfortably at home with the need of medication and lifestyle changes. So these are, the differences are either acute or chronic. But we also have what we call a systolic and diastolic heart failure. A systolic heart failure is when the heart is inability to pump blood to the rest of the body. So that is the most common cause of heart failure. And there is also a newer term, which is what we call diastolic dysfunction or diastolic heart failure. So this is when the heart is unable to relax. So it's actually it's known as a precursor to a systolic heart failure. So, and we currently increasingly recognize that a diastolic dysfunction, which is a diastolic heart failure, is as important as a systolic heart failure in terms of the treatment and also management. And the most common cause of diastolic dysfunction or inability of the heart to relax is due to poorly controlled hypertension.
So
yes.
Anything to do with systolic or diastolic heart failure has to do with hypertension.
Yes, yeah, it's actually one of the main risk factors for that.
Okay, but hypertension can also lead to a heart attack?
Yes, there are various risk factors that can cause heart attack, yes, and hypertension is one of the risk factors, as same as high cholesterol, diabetes, cigarette smoking, and also lack of exercise and family history.
So do these factors also lead to heart failure?
Yes, they do. Yeah, because basically, heart attack is the sudden occlusion of the coronary artery due to lack of blood supply. But you can also have a chronic occlusion, so which means that there is a slow progression of the blockage of the coronary arteries. So the coronary arteries may have about 70 or 80% where patients can still lead a normal life. They may have angina symptoms, which is not detected early. Which is symptoms of chest pain when they exert themselves. So these are what we call angina. So when they exert themselves, they have chest pain or symptoms of breathlessness. It's not detected, and towards the end, it can lead to heart failure.
Okay, and so how would your approach be different when dealing with a heart failure, a patient with a heart failure, as opposed to someone who's come in with a heart attack?
Okay. Basically, the most important when we deal with heart failure is we need to find out what is the actual cause of the heart failure. And the majority of the patients who develop heart failure will need to exclude coronary artery disease or heart attack. So the managements are completely different. So someone who came into the emergency department, for example, with shortness of breath, we need to exclude whether is it a heart attack or heart failure. And there are different approaches. We can do ECG, we can do chest X-ray, we can do a blood test. So if, for example, this is an acute heart attack, then the treatment will be different. The treatment will be to try to open the blocked arteries as soon as possible to prevent the development of heart failure. If the symptoms of chest pain or breathlessness is not due to heart attack, is due to heart failure, then the treatment will be different. For example, we have to give them diuretics to relieve. Diuretics is a medication to remove water from the body, because essentially the symptoms of heart failure is mainly because of accumulation of water and reduction of oxygen in our body.
Why does that happen, though?
The reason is because when there is a reduction in terms of the ability of the heart to pump, there will be a reduction of blood pressure and there will be less blood to the kidneys. And because of that, there will be less perfusion to the kidneys, and it actually causes water retention. And also, if there is a reduction in terms of perfusion to the rest of our body and our organs, then it can actually lead to water retention. And usually this water retention, we can see it from symptoms or signs like ankle edema, which is swelling of the legs primarily. We can also have accumulation of water around the stomach area, which is what we call ascites. So some people actually notice that they're actually gaining weight and they're feeling breathless. And in fact, what they have is actually symptoms, early symptoms of heart failure.
Do you see many people coming in with heart failures at IJN?
Yes, yeah, because IJN is a tertiary referral centers. We do have a lot of patients with heart failure treated in IJN. And surprisingly, some of them they don't recognize that they have heart failure until much later, until advanced age. And it's important for us to know, or doctors needs to know, that we need to recognize the symptoms and signs. Yes.
What are the symptoms, Dr. Azmee?
Okay, the symptoms of heart failure is usually breathlessness. I think that's the main one. If you feel that, you have symptoms of breathlessness when you exert yourself, and if you feel that you can't do the things that you normally do, okay, don't actually just put it to age, okay?
And you just think you're unfit.
Of course, yeah, because I think, fitness levels, you're right, age factor is right.
Correct.
But then you need to know, because a lot of people say, fine, I'm getting old, I'm not fit, and that's the reason why I'm breathless. But in fact, it is due to heart failure. Shortness of breath is one of it. Water retention is also one of it. As I mentioned, problems with ankle edema, problems with ascites, which is water collections in the abdominal area, is also a sign of it. The other thing is fatigue. Okay, a lot of people say I'm fatigued. Of course, there are a lot of reasons why people can be fatigued because of age, this and that. However, fatigue is actually one of the common signs and symptoms for heart failure.
And what about those with congenital heart defects, for an example? That could also lead to heart failure. And often people are walking around with a congenital heart defect, not even knowing that they have one.
Yeah, you're right, yeah. And in fact, recently I just saw a patient who had a congenital heart disease due to hole in the heart. It was never detected before, and suddenly she became breathless at the age of 42 years old. And in fact, what she had is a hole in the heart that actually lead to heart failure. Yes, congenital heart disease can lead to heart failure. The other thing is sometimes what we have is patient who had congenital heart disease treated and operated many years ago when they were a child. Suddenly, later on in life, they may develop heart failure as well. So these patients who, even though that they had a corrective surgery, they have a risk of developing heart failure.
But is it all doom and gloom, though, when it comes to heart failures? Does it mean that, there's no point of return, or, what happens when you're diagnosed?
I think, I have started practicing heart failure for many years now. And I think I've seen, some of our patients with severe heart failure where they were admitted to intensive care unit, for congestion because of breathlessness. And there are a few very selective type of patients that they actually recover. The heart failure actually recovers back to normal. So, and this is also depending on the cause. So, and usually patients who develop heart failure because of poorly controlled hypertension, if they have a proper treatment of heart failure, which includes lifestyle and medication, they can improve. I've seen a lot of this improve. However, there are some conditions, for example, congenital heart disease, and also patients who had a heart attack, because when they have a heart attack, they have a scar in the tissue in the heart, leading to heart failure. These are the type of patients that it is rather unlikely to actually have an improvement of the heart failure. However, patients may have a heart failure with a function of the heart of 30%, but they can live normally and comfortably at home. So we're not saying that it's doom and gloom. There are a lot of treatment options in terms of heart failure.
So when you see heart failure, it doesn't mean that the heart is really failing you as such. Capacity-wise, and how it functions is not at 100%.
Yeah.
Is that what you're saying?
Yeah. Basically, when we actually diagnose, there's several ways of diagnosing heart failure, but the most common investigations that we do is an echocardiogram, which is an ultrasound of the heart, where we measure the actual capacity of the heart to pump blood out of the heart. So usually, when we talk about left ventricle ejection fraction, normal is about 50 to 60%. So you don't get 100% in terms of the LV function. And when you have a 30%, that's about half of reduction of what the heart, the capacity of the heart to function. And if it's less than 30 or 35%, that is what we classify as severe heart failure. Okay?
But when that happens, the other parts of the heart compensate for the reduction in the function, does that happen naturally?
Actually, what happened is even don't think that patients with heart failure won't be able to live at home comfortably. They can. We do have patients who has an ejection fraction or LV function of 15%, okay, and they can actually live comfortably at home. So, in fact, I think, it's also based on the acute and the chronic, as I mentioned earlier on. If it's an acute, of course, even if the LV function is 30%, they were admitted to the hospital. But if they are a chronic stable heart failure, they will be at home. So don't be surprised by if your neighbor who lives comfortably at home has an ejection fraction or have heart failure of less than 30%. Yeah.
And what does that mean?
That means that they are in stable chronic heart failure. I think it's not something that, because when people talk about heart failure, they always worry about these people might not be able to do anything at home. But in fact, with a good lifestyle and medication, we can actually ensure that patients can live comfortably as normal as possible at home.
Okay, that's very good to know. We're discussing heart failures with Dato Dr. Azmee Muhammad Ghazi, consultant cardiologist, clinical director, heart failure and heart transplant from Institute Jantung Negara. When we come back, we'll find out more about how IJN has got a heart transplantation unit, which Dr. Azmee actually leads, as well as something called a mechanical circulatory support system, which IJN has for people with heart failure. Coming up next on The Bigger Picture, BFM 89.9. Good afternoon and welcome to the show. I'm Mira Sivasodi. In our Health and Living segment today, we have the Clinical Director of Heart Failure and Heart Transplant from Institute Jantung Negara, also consultant cardiologist, Dato Dr. Azmee Muhammad Ghazi, who is discussing heart failures with us. IJN has got special services.
Yes,
Is it just exclusive to IJN, or is this available around the country?
Okay. Most of the hospitals in Malaysia or in the world can manage heart failure. Heart failure is a very, very common condition. But what we have in IJN is specifically to provide advanced heart failure treatment, which includes heart transplantation and also mechanical circulatory support. Usually, in all our heart failure patients, what we normally do is we will start with lifestyle first. So patients need to be able to ensure that they don't drink too much water. As I mentioned, that one of the main problems with heart failure is water accumulation. So these are one of the very rare conditions where doctors will tell patients not to drink too much water. So the other thing is to have a low salt intake and to ensure that their weight is at a good level. So that's lifestyle. And then the second approach will be medication. So the medication will include a group of medication called ACE inhibitor or angiotensin receptor blocker, beta blockers, and there are a newer group of medications now called ARNI, which is the angiotensin receptor neprilysin inhibitor, which has been launched the last couple of years. And these are what we call life-saving drugs, because we do know that by treating our heart failure patients with this group of medications actually improve their survival, reduce their mortality, and also reduce the risk of being admitted to the hospital. So, however, regardless of 1 and 2, lifestyle and medication, we will always encounter patients who still symptomatic, who still breathlessness, who still unable to perform their daily activities because of heart failure. So this is when we go into a little bit more advanced treatment for heart failure. Before we consider heart transplantation and mechanical circulatory support, we also have what we call a device therapy, so which includes cardiac resynchronization therapy. It's a pacemaker that we insert to synchronize in selected patients, to synchronize the left and the right heart in patients with heart failure. So there are some, so this is also to improve their function and also to reduce their survival in patients with heart failure. But if with lifestyle, with medication, and also with device, with pacemaker, they're still symptomatic, then, these type of patients will be considered for heart transplantation and mechanical circulatory support.
Heart transplantation, we roughly know what that is, yes. But what's mechanical circulatory support?
Okay, so basically the mechanical circulatory support is a pump that we can insert surgically, so the patients will have to go for an open heart surgery. It's actually a pump that we put in the left ventricle, so where the pump can suck the blood out from the left ventricle, which is the oxygenated blood, and return back with a pressure into the aorta. So this blood will go back to the brain, to the kidney, and to the rest of the body. So it's actually replacing the function of the weakened heart. So it's just technically it's a pump that we actually inserted within the heart that actually that can actually provide a good pressure to ensure that the blood can go throughout the body.
How successful is that?
Okay, so of course when we implant mechanical circulatory support, or what we also call the left ventricular assist device, LVAD, the patient themselves are in heart failure, so they are already a high-risk category. And some patients will have some other comorbidities, some other problems, for example, coexisting kidney problem or coexisting diabetic or something. So they are not the best candidate for surgery. However, if the surgery is done successfully and the patient survive, some patients can actually live up to 15 years with the mechanical circulatory support. But of course, there are a lot of complications that can happen with mechanical circulatory support, which includes strokes. Because if you imagine the pump actually suck the blood out and rotate, give it a pump and a pressure go back to the body, and clot can form within this. That the blood clot can actually go to the brain, causing a stroke. So in all our patients who we put in the left ventricular assist device or the mechanical circulatory support, they will need to be on anticoagulation. So which means that the blood needs to be thin to prevent clot formation. But with the newer generations of left ventricular assist device, the risks are much less now. So we are quite hopeful that we can have better, more durable, less complications left ventricular assist device in the future. And of course, if it's smaller and easier to implant surgically, then it'll be much better, for us as well.
Do you carry out many of these mechanical circulatory support for patients?
Yeah.
And is it costly?
Yeah. I think in terms of potential number of patients, we have a lot of patients that potentially can be benefit. However, in reality, because of the cost issue and the complications issue, we have to be very, very selective. So majority of the patients are usually we will choose the best possible patients to have the good outcome. So these patients will have a single organ failure. So if they have multiple organ failure, for example, if the patient had a stroke in the past or kidney failure, then we don't tend to put in even everywhere in the world, because to reduce the risk of complications. And of course, the cost is the other issue. The machine itself, the left ventricular assist device, can cost up to about 500,000 ringgit, and including the surgery can come up to about 800,000 to 900,000 ringgit. So it is expensive. So I think this is something that we have to discuss with the patient in terms of the cost. And in IJN, we have grants that we can help this, but of course in selected patients, of course.
So we talk about heart transplants as a possible option for people with heart failure, but we do know that organ donation in this country is, it's picking up very, very slowly. I mean, how successful? Have you done many heart transplants in the past?
Okay. In terms of the heart transplant program in Malaysia, IJN is the only hospital that runs the heart transplant program. It started about 20 years ago. So far, we have transplanted up to about 20 to 25 patients, okay? And of course, selection and experience for heart transplantation, performing heart transplantation is crucial. So we need a good candidate, and of course, the surgeon that operates has to have a good clinical experience in terms of the success of it. We do know that in patients with end-stage advanced heart failure, heart transplant is the only best treatment option for this patient. So we have currently in our waiting list up to about 10 to 15 patients who are actually waiting for heart transplantation. But of course, donation is not easy, mainly because of perception, mainly because people are scared, and mainly because of objection from the family members. These are the difficulties that we have. But of course, when more people are aware about organ donation, and we hope that these will grow in the future.
Is it difficult, though, to try and pair a heart with somebody?
Okay.
Is it easily transplanted?
No, it's actually quite complicated.
I can imagine.
Yeah, so the patient who the recipient, the potential recipient, has to be assessed appropriately. There are a few contraindications, which means that there are things that if the patient have kidney failure, if they have development of complications from the heart failure, for example, pulmonary hypertension, then they are not suitable for heart transplantation. And of course, when we have a patient who are suitable in our waiting list, then we have to match it. The match is usually based on blood group, ABO compatibility, and also due to height and weight, because we cannot put in a heart from a very, very small person into somebody who's obese, because the heart will not match. And we also need to match in terms of their pulmonary pressure as well, because the heart is just not connected to the rest of the body. It's also connected to our lungs. If there is hypertension in the lungs, then it won't be suitable for heart transplantation.
Okay. Your work must be really quite exciting.
Very exciting. If we do have patients who's going over, and I think the more exciting is actually to see patients who we know statistically that they may not survive up to 5 years, and after transplantation they actually survive 19 years. So the longest surviving heart transplant patients that we have is up to about 18, 19 years currently.
So IJN has probably done one heart transplant every year since it's set up approximately?
We hope to be more, of course, and I think in the future when we have more donations, organ donations, I think we hope that we can do more.
So that's the reason why you don't do enough?
Yes.
Because you don't have available hearts?
Yes.
Okay. So does that mean that you do more mechanical circulatory support for people?
Yeah. I think now, even throughout the world, there is a reduction in the number of heart transplantation, mainly because of the donation. And there's also an increase in terms of the use of mechanical circulatory support. Yes, so the answer to that question is yes. We tend to do more. The only thing about mechanical circulatory support is the cost issue. So
you mean it's cheaper to do a heart transplant?
Yes, yeah, because the heart transplant, because the organ is in a way is free, and the cost is only for surgical cost and a post-operative cost. But for the mechanical circulatory support, we have to pay for the device, which is expensive.
Okay, and do genetics play a role when it comes to heart failure?
Okay. Yes, they do.
We always talk about heart disease, but what about heart failure?
Yeah, definitely, because we do have a condition where patients develop cardiomyopathy, which is can be genetically predisposed. They can actually develop heart failure. Yes, definitely.
Okay.
Yeah.
Let's talk about sleep apnea. I mean, we know what sleep apnea is. It's this where you go to sleep and sometimes you struggle to breathe. You wake up and then you feel very sleepy in the day. And one of the reasons people suffer from sleep apnea is when you're obese, overweight. Now, is there a connection between sleep apnea and heart failure, for an example?
Yes. The reason why we get interested in sleep apnea is because of the connection, of course, because sleep apnea can actually lead to coronary artery disease. It can also lead to hypertension. It can also cause diabetes. And with that, you can also develop heart failure as well. And also, we also found that majority of our patients, I would probably say about 30 to 40% patients with heart failure will have coexisting sleep apnea as well. So, so I think it's important for us to recognize. The only thing is we have to know that not everybody who snores has sleep apnea, but snoring is the main feature of sleep apnea. But the other thing that we need to know is we need to know that sleep apnea is when we stop breathing and we wake up suddenly. So it's a disturbed sleep. So these people will not be able to go into deep sleep, and they will probably have about 5 to 20 times of disturbed sleep. And this is what we call sleep apnea. And as you rightly say, when they wake up in the morning, they have headache, they cannot concentrate, they become irritable. Some people go into depression, and also some people can have problems with work. They were not able to work and not able to sustain a relationship, for example.
So your advice would be to do a sleep test?
Yeah, but first of all, I think you do need to be examined by a doctor. So we will do a physical examination of the heart and also the lung. We also need to look at the throat, because mainly the reason why sleep apnea happens is because of the obstruction of the airway, and it can also be due to anything bulky, for example, tonsillitis or adenoma, so something like that. So these are the things that can cause. So we need to examine the throat to see whether there's any physical obstruction. And of course, the sleep study is the diagnostic for sleep apnea.
Okay. Yeah. Is there a heart failure support group by any chance?
Okay, currently we don't have in Malaysia. Okay, so but
do we need one?
Of course we do need. Yeah, the reason why is because at the moment, for example, if patients comes into IJN, we have a heart failure ward that they actually treated with the heart failure doctors, heart failure nurses, physiotherapists, dietitian, and when we also review them in clinic. So we have a heart failure clinic that we see them maybe every 3 or 4 months. However, we don't know what happens at home. Okay, so patients may be depressed. Patient may not be able to know where to get help. People may not be able to get financial support as well. So I think, what we wanted to build up currently is actually to develop a heart failure support group, something similar to what we have a breast cancer support group, for example. So we do know that there's a lot of patients with heart failure and they're usually scared. They don't know what to do. So with the support, we should be able to advise them in terms of clinical, support them at home, and perhaps maybe if there is any financial issue, for example, going through a device, the device, for example, pacemaker is expensive, perhaps, if we have that that, then we can actually aim to provide some sort of financial support, for patients at home. So a support group is definitely needed in Malaysia, and this is something that we are trying to work on in IJN. But it's not specifically for IJN, and we will offer this support group at home for patients the rest of Malaysia.
What will be your advice, Dr. Azmee, as far as heart failures are concerned?
Okay. For my advice is heart failure is a common condition. The reason why is because you can have heart attack, you can have hypertension, you can have arrhythmias, any problem, you can thyroid disease that can lead to heart failure. Number one is we need to recognize the symptoms of heart failure, which is important. And number two is if you have heart failure, you need to ensure that you're on the right treatment. There's a lot of patients that we see they are not managed properly. It needs to be managed properly because the potential of life-saving using medication, lifestyle is there. So, but unfortunately, there might be some physicians, some doctors who are not so well-versed in terms of the management of heart failure. And they perhaps maybe don't put importance of heart failure in terms of their management. The reason why is because some doctors may think that it's the end when you have heart failure, but actually it's not the end, it's actually the beginning in terms of the treatment. And the other thing is, of course, when someone has heart failure, or if you have family with heart failure, you need to ensure that they're on the right treatment and make sure that they know that there is a treatment available in Malaysia, which is the same as what we have worldwide. So Malaysia is very advanced here, and we in IJN has all the services that we can provide for patients with heart failure.
And if there's a problem with cost, then there are options?
Yes, yeah. Of course, in IJN we also have IJN Foundation that we can help to assist. So I think this is something that we can look into. But of course, it will be on individual basis.
Okay.
Yeah. Regarding the sleep apnea as well, I think a lot of patients or a lot of people don't know that they have sleep apnea. I tend to ask most of my patients whether they have problems, difficulty in sleeping and snoring, and they usually ask their partner, which is right, yeah, because you would know whether you have problems with
and don't be in
sleeping.
denial.
Yes,
like most of us do.
Yeah, you're right. Yeah, and I think in terms of the sleep apnea, is also very, very important.
Of course,
it's preventable, it's treatable, and also we can detect it early. I think that's important.
Well, good to know that it's all bright and optimistic out there. I mean, when you say heart failure, normally we always think it's all doom and gloom.
Yeah.
Obviously, it's not. Thank you very much for sharing your thoughts with us. That was Dato Dr. Azmee Muhammad Ghazi, consultant cardiologist, clinical director, heart failure and heart transplant at Institute Jantung Negara on the Bigger Picture BFM 89.9.